Okay, so hello everyone, all participants. I'd like to welcome everyone who's joining this event, whether on Zoom or on Facebook live stream. So to the event on waging war against a, quote, little flu, masculinities and COVID-19. And thank you all very much for joining us. So first of all, I'd introduce myself. I'm Christine Chinkin. I'm a professorial research fellow at the Centre for Women, Peace and Security at the London School of Economics, and I'm principal investigator on the United Kingdom Research and Innovation Global Challenges Research Fund, UKRI GCRF, research hub on gender, justice and security, a research hub that's located in the Centre for Women, Peace and Security. And so before introducing our speakers to this event, I would just like to say a couple of words about both the hub and the event. So first, the hub. The hub is a 5-year multi-partner research program into ways to address the global challenges presented by the Sustainable Development Goals, in particular Sustainable Development Goal number 5 on gender equality and Sustainable Development Goal number 16 on peace and justice and institution building, essentially ways of trying to build a sustainable peace. And then also the Security Council's agenda on women, peace and security, which is an agenda to enhance the participation, meaningful participation of women into decision-making and policy-making about conflict resolution management and post-conflict reconstruction. So the hub has over 30 research projects across multiple countries with a number of partners involving researchers from civil society, from women's organizations, youth organizations, arts associations, from governments, from international governmental institutions, essentially into gender justice and inclusive peace. And today's event relates very much to the themes of the hub. The event today is essentially to explore the language and the approach adopted by some world leaders to dealing with the pandemic. In particular, the use of militaristic metaphors. So we hear them talking about waging war against the pandemic, about workers being on the front line of action against the pandemic. We are seeing priorities shifting, priorities being given to safeguarding economic interests rather than protecting lives. We have not seen any reduction in military expenditure, for instance. And I think there's been a ratcheting up of aggressive talk between some countries, hiding behind the pandemic in some ways to use this language of militarism and militaristic behavior. So today's event will ask, what does this tell us about constructions of masculinity in times of crisis and catastrophe? How does these approaches and language impact upon a community's ability to cope with the pandemic and to rebuild post-pandemic, whenever that time may actually arise? How can we develop different institutional and everyday ways of responding that build upon community interests and reflects community concerns to their lives? So to lead the discussion into these issues, we have two great speakers. Both are members of our hub and research on the stream on masculinities and sexualities, one of the 6 streams of the hub. So first thing I'd like to do is thank both Henry and Baha for joining us this afternoon, and well, this evening for Henry, who's in Myanmar, and for joining us. Henry, I will introduce first. Henry Mertinen is a researcher on gender and human rights. He's currently with Mosaic MENA, which is an LGBTQI NGO, which is based in Lebanon, although he's in Myanmar. And he is researching especially on understanding the experiences of persons of diverse sexual orientations and gender identity expression on the impact on such people of the Syrian war and of issues around displacement, particularly in Syria and Lebanon. And Henry will speak on how popular culture shapes gender responses in times of crisis, especially, of course, the current pandemic. And then Henry will be followed by Bahar Manzar, who is the General Director of People's Development Organization, a women's rights organization based in Iran.
So I think Christine might be having some issues with her connection, so I'll just jump in for a second. My name is Evelyn. I also work at the Hub. So Christine was just introducing Bahar, who is the second speaker for us today. So let me just jump in there. As she said, Bahar is the General Director of the People's Development Organization, a women's rights NGO in Kurdistan, Iraq. She's a civil society and women's rights activist working on gender-based violence, trauma, economic and livelihood support, and offers services for women in shelters, as well as supporting Yazidi ISIS survivors and children born of war. In the GCRF Hub, which Christine has just introduced, she is working with the American University of Iraq Suleimani on the Masculinity, Violence and Prevention Project, investigating the mechanisms that construct masculinity in post-invasion Kurdistan, Iraq, to support the promotion of alternative masculinities. So Christine, welcome back. I've just introduced Bahar, so I'll hand over to you again. And you're still on mute, so there we go. On to you.
Okay, thank you, Evelyn, for taking over. I don't know what happened to the connection then. So Henry will speak first for 10 minutes, followed by Bahar for 10 minutes. Then we'll have a short discussion between ourselves before handing over to questions and answers from the audience. And we would ask the audience to send questions via chat, where we will see them and then repeat them to the speakers. Before just handing over to Henry, point out that the audience's microphones are muted by the organizers and cameras are also off, that the event is being recorded and the recording will be available at a later date. So thank you very much again, everybody else, for joining, for the organizers, and particularly for Bahar and Henry. And I'll hand over to you, Henry.
Great, thank you very much. I'll just share my screen here, and I hope that the sound is okay here from Yangon. Great. So I'll be talking in this presentation on masculine imaginaries and how kind of popular culture visions of what men should be like, especially male leaders should be like, have, I would argue, shaped the responses of some political leaders, and also how it has shaped the way that people reacted, especially initially, to the COVID-19 pandemic, and also look at what has been invisibilized in these imaginaries. So what I basically argue is that gender roles, in this case, masculinities, and the expectations of what it means to be a man in a given situation are shaped in part by imaginaries, by things that we get through various cultural artifacts, be it from stories we hear as children, or through movies, through comic books, computer games, history books, or probably more likely the History Channel, which tends to be a quite militarized way of showing history. And that there's a feedback loop between the imaginary and the symbolic and lived realities. So even if it's a movie about events in a galaxy far, far away, or set amongst the hobbits, or it's about superheroes, these imaginary stories and symbolic stories tell us things about how we are expected to live our lives as men or as women, about what is right and what is wrong, whether to trust institutions and question institutions, whether to rebel or not. So, and these kinds of imaginaries are in part based on reality, but then also impact on the way that we see reality. And I'll get more into that in a moment. And so for this short presentation, I'll be looking at this in the context of the COVID-19 pandemic and looking especially at the ways in which three male leaders, Donald Trump of the US, Bolsonaro of Brazil, and Boris Johnson of the UK, who do have very openly masculine coded style of leadership, how they have been channeling particular masculinities and I would argue also failing in their pandemic response. I will then look at sort of the influence of some of these gendered imaginaries of catastrophes, especially the way that they're presented through movies and other public popular culture artifacts on public responses, how sort of the zombie apocalypse or outbreak or alien invasions and how their people's reactions to them have shaped actual reactions in real life, and then look at what has been invisibilized in these stories that we tell each other about pandemics, about catastrophes, and how that relates to everyday life, as we've seen over the past 6 months. So the three leaders I'll be talking about, I hope you can see the Bolsonaro mask there, especially. So they're Trump, who here shown not wanting to wear a mask that's being handed to him, a Bolsonaro supporter who has a face mask that depicts Bolsonaro as a kind of Brazilian version of Captain America, and Boris Johnson last week standing in front of a Spitfire jet and a Eurofighter Typhoon jet fighter, and looking at how sort of their particular ways of being and performing masculine leadership is based on some of these expectations of what they think a male leader should be. And all three of them have somewhat similar approaches, but also somewhat different. So I'll look at some of the similarities first, and there's definitely nuances and differences between them, but all three of them do have this kind of alpha male approach to politics and to the leadership, of trying to depict themselves as heroic warriors, as tough guys, as eternal winners. And this is especially the case for Donald Trump and Bolsonaro, maybe slightly less so for Johnson, but there is also that streak in him. This is also linked with a populist narrative that very much draws on anti-intellectualism and a disdain for so-called lesser men and women who, as Boris Johnson called them, are girly swats for paying attention to science, to details, to process. And all three of them also show a high level of disdain and unwillingness to cooperate with other countries. Trump, of course, pointing out the WHO, but in the case of the UK, also an unwillingness to engage with what has been offered to the UK through the European Union as ways of dealing with the pandemic. All three of them in their public persona but also the pronouncements have undertones, or in some cases very open misogyny, homophobia. Bolsonaro, for example, saying that face masks are for gays. And in the case of Trump and Bolsonaro, less so for Johnson, even though there are also glimpses of this in some of his earlier writings. Also, a lot of racism that is there in the way they do their sort of dog whistle politics, to use that term. All three of them also have, in the COVID pandemic response, openly displayed willingness to be taking risks, to be disdainful of the and disregarding the rules that their very own governments have put in place, especially around the wearing of face masks. And this, of course, hasn't gone down so well for Johnson or for Bolsonaro, both of whom have contracted COVID. They tend to surround themselves with this coterie of men, and especially in the case of Trump, be very, very aggressive and quite insecure in the presence of competent female leadership. And there's very much a focus on getting the economy going over public health issues. And I would argue that all three of them try and struggle to fill in these symbolic roles. Trump of being a successful businessman and CEO, which he wasn't really, but tries to convey that persona also in running the USA. And for a short time kind of flirted with trying to be a wartime president, but didn't really have the attention span to carry on with that. Bolsonaro very much playing up his background as a military man, as an athlete, saying that even if he did get COVID, he wouldn't notice it because he's so fit as an athlete, and also drawing on sort of Brazilian gaucho imagery by going horseback riding and so on. And Johnson trying to channel this persona of a Churchill-type leader. And I would argue that all three of them to a degree fail at these symbolic roles and masculinities that they're trying to channel, but these are also masculinities which are not really helpful in any way to the COVID response, because they're not really the kind of qualities that are needed, because the US is not a company or a reality show. Brazil is not a small military unit, nor is Johnson, for all his attempts, able to convey the sense of a wartime leader, even if that is something, even if he were successful, that is not necessarily something that is needed for a public health emergency. So moving then on to sort of how popular culture has influenced the public imaginary and public responses to the crisis. So a lot of popular culture descriptions of apocalyptic threats, of pandemics, of alien attacks, of zombies attacking us, and also superhero movies, which are, of course, extremely popular at the moment, tend to focus on individual heroes and male or strong leadership, mostly male. And these are then often characters who do not deliberate, do not cooperate with others, do not ask for advice, but take direct action, which is something that in the movies usually plays out well, but in reality has not played out that well. The depiction of society is also one of dog-eat-dog competition, that if you don't fight for yourself, then you will not survive. And if you don't believe in the dog-eat-dog nature of society, of this eternal state of warfare, basically, between humans, then you're being naive and will likely die. And this, often in the movies, is then linked to a need for armed defense, of buying weapons, of stocking up on weapons. And in most of these movies, also, as soon as there is a crisis, systems collapse and there's widespread looting and anarchy and so on. There is strong suspicion of technical expertise and of nanny state institutions other than the police and the military, and these movies then tend to end with a decisive victory or a clear end point, which is something that, of course, we're not seeing with the pandemic at the moment. And I would argue that these kinds of ways of seeing how societies would act to a pandemic situation have in part led to self-fulfilling prophecies in some countries. I mean, kind of on the more humorous side, it's meant that there were sort of these runs on supermarkets to buy toilet paper and scuffles in supermarket aisles, but also more seriously than there's a massive shift of unpaid labor from the state sector, from the education sector, for example, to women in the family, putting at risk of so-called frontline workers in hospitals and in buses or public transport and so on. And in part also then, there has been armed violence, not that much luckily so far, but there have been cases of that, and a systematic undermining of the social welfare systems prior to the COVID crisis. So in these public imaginaries of crises, there is then this highlighting of masculine coded responses, of so-called realist responses, which may not be realistic, but are called realist, of this, with a very negative view of human nature and of society, stressing of neoliberal responses instead of communal responses, and a letting to die of the weak and the naive. However, what is invisibilized in these imaginaries, and what has really been kind of the key to the success in those countries which have had more successful responses, is that there have been functioning state responses and functioning state systems. What has also, however, been invisibilized and does not come up in movies or these imaginaries of pandemics is the amount of everyday care work and invisibilized care work of feminized reproductive labor that is needed to keep societies going. What is also not visibilized is the widespread lack of public violence. In most countries, there hasn't been public violence, and in most cases where there has been violence, this has been perpetrated by state actors in clamping down on lockdowns, for example. There has been a lot of cooperation and solidarity, which is also something that one tends not to see in these movies. And the very mundane everyday life of being in a pandemic for now 6 months is something that, of course, does not make for a great storyline. Also invisibilized, unfortunately, is the massive uptick in domestic violence and probably also child abuse cases that's happening during lockdown, and particular vulnerabilities of people with pre-existing conditions, of older people, of diverse social persons, people with disabilities and structural racism, and also that likely this will not be something that will be solved by a male leader flying in a fighter jet or anything like that, but there will likely be no grand finale, but a fizzling out of the crisis over the long term. But I'll end there. Thank you.
You're still on mute, Christine.
So,
perfect.
Okay, thank you very much, Henry, indeed, for that quick overview of, on the one hand, what we do see in popular imagery, and then, yes, what is seen as boring, as you say, the hard and community responses to so much that are so often associated as well with women. Baha, I'll turn to you to hear your opening of the discussion. Thank you.
Thank you. Thank you for inviting me today, and I would like to thank Dr. Choman from American University Gender Center in Suleymania to nominated me for this event. I would like to start with my presentation. I will share presentation now. Just sorry, just a moment. No.
I have your presentation. Yes. I can share it if you'd like.
Can you just help me? I don't know what's the problem here. Thank you. Good.
Yeah, Zoe, if you could start maybe.
Yes, thank you.
I'm sorry, mine's saying it's failed to start.
Let me see what I can do.
Try again, see if that works.
How is this?
Yes, thank you. it is this.
Bahar, if you didn't, just let me know when to switch to the next slide, then I will do
yes,
that.
you can just go through the presentation. Yes, I don't like to say very long about PDO, but we are one independent organization in Kurdistan region, and we work on GBV and SGBV cases in Kurdistan in different areas. And during the quarantine time, it was very hard for us because we couldn't have like face-to-face, as you know, but many of the SGBV cases, we had a problem with this issue, but we in PDO we have two sectors: protection and development. For protection, as I said, case management, we have services, therapists, remote services. It was very new for us because, as I said, it was many of these cases, and we have data about number of these cases we had in quarantine time. Development, it was like we used our social media. We had awareness sessions, we had capacity building, we had meeting groups with other case managers, other organizations to have to work together to solve our problems, because we didn't have any support from like government and Directorate Against Violence. It was like GBV subcluster, and we work with other organization. It is GBV working group in Suleimania. We had we had many meetings together to solve our problem, to have case conference, to know about sensitive cases. It was one of the work we had in quarantine time. Can you just go to the next? Thank you. Yes, and as I said, through social media, and we collected data. We have some photos, some pictures. It was like masculinity, and it was pressure against women organizations, and very like special photos, and we collected some of this data and posts in social media. And some of the places it was closed, like a woman shelter in Erbil. In 2 weeks they didn't open the shelter because it was not it was everywhere it was closed. And one of the challenges we had in quarantine time, it was about this issue. Can you just go to the next page, please? Yes, this data, we had all these cases just in 3 months in quarantine time. As you say in this data, 1,032 cases, and in different areas we had legal cases, we had GBV cases, SGBV cases, and we had we followed some of the cases also. And follow-up cases, it was 69. It was just remotely, but legal cases, we had some days the court was open, but it was after 2 weeks it was also closed. We had also problems with the police and different services in Suleimania and in different areas. But total we had 1,032 cases in 3 months in quarantine time. Yes. How to respond to masculinity through media. We have Chawi Khalag, it is our webpage in PDO for Women Issue. It is especially for Women Issue, which is an online platform supervised by the media department. The website works towards achieving women's rights and gender equality and masculinity. It brings the present issue of women back in Kurdistan. Chawi Khalag, journalist research and modern analysis, found that the individual and institutional responses to the pandemic negatively of women issue during the time, since they work on women issue in our society. And we had like awareness sessions through Facebook. Now we think it is very important to be better, to have a better capacity online working, because in this time one of the way to distribute, to have information, awareness sessions, capacity building through social media. And we had our brochure in Facebook. We had our information, number of the case managers. We distributed in different areas. We had many cases through Facebook and social media. And I have some pictures sampling to show. This one, for example, this one, it was this comment. This picture shows masculinity very clearly, since it is present that working that at home, shame, and it is not man work. We had many photos in social media and we discussed on it, because before we didn't have, like, for example, these photos, but it was many of the photos published, not just in Kurdistan, but also in Iraq, in Arabic language, in Kurdish language. And it was every photo, it is something against women, something like masculinity, a culture in our society. Yes, it is one. It was very famous photo actually in quarantine time. It shows that the man in the most vulnerable group in the society, since it is opposite background. It is just in Kurdish, go out from home, because they said many of the men, they are just at home. Yes, next please. And one of the famous video actually in quarantine time, it was this photo. It is video, but I just take the photo of the video. This is a clip of the video. It appears that the man is doing bakery work, and in the video he said saying, why corona don't kill women? Because in the beginning, we heard from the doctors, from the media, that the coronavirus just kill women, as you know, in the beginning. And they said, why? It was like, we will all be saved if coronavirus kill women. It was one video, and we have this video. We saved the video. One other photo. The main reason of this photo is to show that staying with a woman in the same house is like staying in prison. And it was one, many of people, thousands of people, thousands of men shared this photo in media in two languages actually. It was not just in Kurdish, but we know it was many of this photo, it is in Arabic and Kurdish. Yes, he is one of the actors in Kurdistan, and the man is in this photo dressed like a woman. It is like not good, you know. It is. They mean it is like woman, and show that the housework is just for women, not for men. And yes, it is one up also in the photo. Making comedy video about men in quarantine time was other way to show women in crueler ways. The picture show that the women are act badly with their son and her husband, and made them work all houseworks. And she don't do anything, just man. They said it was like very masculine, very special photo. And one of the photo they shared, it is this photo, two photos, yeah. We had many like assessment and survey, but I chose for this event two of them. One of this survey, it is Care International Organization. They did the assessment, and it was rape gender analysis COVID-19 by Care International. And other one is a DHRD, it's a local organization, survey regarding to domestic violence during COVID-19 time in KRI. The DHRD is a Democracy and Human Rights Center in Suleimania, and they did this survey. But we have other also assessment and survey, but I have just these two. And this concluded the woman and girl, man and boy are differently affected by COVID-19 pandemic due to the different roles given to them in their communities, needs, capacities, and coping strategies they have. I have just one example for this. I am co-chair for GBV working group in Suleimani. I attend the GBV subcluster in Baghdad. It is many other organizations. We discuss about some of the issues. one of the cases, it was one girl. She was just 17 years, and she had symptoms for coronavirus. But the family, they didn't give permission for this girl to go to the hospital. And two of the organizations in Baghdad worked with this because they said it's against our tradition. One girl cannot go to hospital, but UN agencies, they worked on it, and they followed the case with two organizations in Baghdad, and they discussed about this issue because we don't know how many cases in Iraq it was like this case, because they said it is WHO's responsibility to have awareness about these problems against women and girls. The second one, the response, sorry. Yes, you can go to the DHR, this assessment, because I know we don't have enough time, but I can, yes. And another, like COVID-19 and quarantine, additional factors behind increasing domestic violence. In this survey, we have a document we have a increasing domestic violence in quarantine time in Kurdistan region. And here is some research samples table which present the reasons and results of domestic violence during COVID-19 and quarantine. We have some, like education and COVID-19. We have these numbers. The information from table 3 suggests that the female and male with a higher education level were more exposed to domestic violence. We have these numbers. Table 8, from the quarantine and the spread of the COVID as the dangerous pandemic created a complicated psychological condition for the families, and smallest friction made family members to have a reaction which result in the violence. We have like harassment in high level, but all these people, they attended the survey. It is 508 number of the people they attended the survey. The data from above table shows that the perpetrator violence in different family stage. We have different father, mother, and in family. All this number shows who were the it showed the reason of this violence during the quarantine time. We have also this number. Staying at home, salary is one of the main problem actually in Kurdistan. Many of the people, they had this economic problem and jobless, and it is the children's fault. We have 3.7, for example. It is result of this in this time. Result of the domestic violence, feeling sad, suicide, yes, wrong decision. It is I cannot speak very, like, I don't have long time, but I like it to show you, to support my photos, to show you how was the domestic violence and masculinity in quarantine time. Yes, if we can. Challenges. One of our challenges, we don't have enough capacity for remote services. We asked agencies, we asked a trainer, we asked people to have a good capacity for case management, because it is not like work from 9 to 4. You know, some of the cases they cannot call to the case managers in for example in this time. Sometimes we received a phone calling from the cases 11 o'clock. We had the emergency cases to deliver them, to help them to go to the shelter. And one of the issue, it's a reporting issue of the reporting properly, changing in the work hours, as I said, especially in nights, increased domestic violence, engaged more on the social media than social life, differently in online working, control control, steer and close the institution due to the COVID-19. Some of the governmental places, it was remotely and online. Lack of experience with services, lack of the capacity for remote case management, and also SGBV cases. Yeah, sorry, I have not enough time, but it was very quick.
You covered a great deal of material very quickly, so thank you very much about that. And I think both of you have shown very, very vividly through the photos and your comments, both the realities and then the constructed realities and the constructions around masculinity in different contexts. So in just a very short discussion time, I wonder first whether either of you would like to reflect on what the other person has said, or you may have some responses to each other. But I mean, I think that what we are clearly seeing with these different constructions of masculinities and how they are responding in a particular context of the pandemic. And I think, again, as both of you have emphasized, that this in fact is building in many ways on what we're seeing more generally, a sort of a backlash against women's rights, a backlash against gender, a growing homophobia. So the really big question is, and I give you 2 minutes each to think about it or to respond, how do we transform constructs of masculinity in a crisis, in a catastrophe? Is this a moment? Is this a moment when there is the possibility of transformation? Or is it in fact a moment of entrenchment when it becomes even harder and to do so? So I don't know, Henry, would you like to sort of reflect?
Sure. And I think that there is no one straight answer to that. I think it is a moment where it can go both ways, and will likely go in different ways in different societies. I think, sort of optimistically speaking, this is an opportunity to highlight how a lot of the most marginalized work and least well-paid work in society is extremely valuable and necessary, be it the people stocking supermarkets or cleaners or healthcare workers or bus drivers. And I hope that there is a reckoning that these are sort of some of the most important jobs in a given society, and not some of the others, like, I don't know, hedge fund investors or other sort of celebrated masculinized jobs. I think it's also hopefully been an opportunity for men to rethink their roles in the home, and have more of an appreciation of what kind of invisibilized domestic work and care work is done. And I found it interesting with Bahar, your presentation there, where it's seen as horrible that men have to do domestic work, and this is something that you can joke about, that women force men to do domestic work, whereas for women it's something that's taken for granted that women of course have to do this kind of work. So that I hope that there is that shift in having more respect for that care work, for domestic work as well. But it can also go the other way, and I think it will in some places go the other way, that there is a shift again of pushing women out of the sort of the formal workspace into domestic work. There's a higher valuing that we also see in sort of academia of men being able to use this time to produce journal articles, and women are not able to do that. So I think there is also a huge risk of a retrenchment of patriarchal values happening.
Thank you. Bahar, how do you see the chances of transformation or change at this point? And I think Henry has particularly emphasized that different societies, that the context is very important here as well, that the different responses in different societies.
Yes, actually, in general, it's unusual for men in our society to be at home, and housework, it is like just women's responsibility. And with other organizations, we discussed about this issue and how can we restructure our work? How can we have a focusing of this issue? Because before it was not like now. You know, we know we need to have a better capacity, to have a lobby. We need to have advocacy, and we have like social media here is very open. You can say what you like, and when you report some of this issue, it is not important for example for police, and it is easy to disrespect people, especially women. And it is like all these things like from ID and account. It's like not we know who is these people, but when you go to the police, it is nothing for them. Actually, we need to have to focus on this issue, because as I said, in general, it's usually many, I can say many, the highest percent of men, they don't do housework. But from quarantine time, it is like I can say in other way, maybe it's it is positive for women. We know all these problems in Kurdistan, and people speak about this issue. And some of these women, some of these men, they wrote like positive thing about women and children and responsibility. But in general, masculinity, and as I said, it is we need to discuss. We need new actually strategy to stand up against masculinity in online masculinity, not like before in villages, in different areas in work, but online. You know, it is one of the issue we discuss it with other organizations.
Yeah, I mean, I think that, sorry, I think there's also, you know, we're talking about changing attitudes and sort of the popular aspect. Clearly, there's also an issue around the leaders themselves, which Henry very much focused on. And, you know, how do we get particular leaders to take a different approach? And we've had two questions from the audience, which I think come on to the same sort of idea, which is, you know, what's the relevance of the regime type in the first place, or the political orientation? Because quite clearly there have been other male leaders who've taken a very different approach. And is that connected to their political views? Is it connected to the type of regime that they are operating in? Or are there other factors at play as well? So maybe Bahar, if you'd like to start this time, just thinking perhaps a bit more about the you know, the leaders and their approach.
Yes, to have an influence, to have a lobby on these leaders, we did before, like advocacy, but now we need we have a contact with them. We delivered our like alternative solution for some of the problems, but now we work on this issue from with other organizations. We have a connection, communication with leaders, with political parties. They have very high, they have power, and parliament, and different people. They are in the, for example, culture department regarding the TV and series and this masculinity. This masculinity ideas, they publish it in TV. In this TV, they have like permission from governments. Actually, in quarantine time, before quarantine time, for 8th of March, we had collected many of these issues to go to the culture department to show them how can they help us to stop some of this like disrespecting, insulting of women. But in quarantine time, we couldn't do this. But now we continue our campaign and lobby to have influence in of these leaders.
Thank you. Henry, have you any reflections on regimes and types of regime?
Yes, and I think again, it's quite a sort of a mixed bag. There's been liberal democracies that have done really well, with all democracies that have done really poorly, authoritarian regimes that have done very well, authoritarian regimes that have done very poorly, left-wing, right-wing, again, sort of some have done very well, some have not done well. And I think it maybe comes down more to other factors, whether there's a trust in the government, whether the government is seen as being competent, whether there's systems in place that function, and that can also be even countries which don't have very well-funded systems have at times been able to respond much better than some of the world's wealthiest countries. So Timor-Leste, for example, has been doing, and a lot of Pacific Island countries have done quite amazingly well with very limited healthcare systems, where countries like the US or the UK have failed. So I think it's more about sort of competence and perceived competence, about taking leadership and trusting also sort of medical expertise, and not putting that in second place compared to, let's say, a primacy on the economy or in the military. And I think what's also really quite striking is that all of the 5 permanent members of the Security Council, all of which have nuclear arsenals, have done very poorly in this pandemic in the responses, whereas then other countries which have focused much more of their efforts, even if they have on healthcare and social welfare provisions, have done a lot better job in their response.
So thank you. And I think sort of closely related to, you mentioned trust, particularly, Henry. David Dursmith raised the question of expertise. And part of that trust, I think, comes from a belief that, in fact, those in charge have got the expertise to deal appropriately with the pandemic. And I think another side that we've seen is so-called male experts suddenly developing an expertise that may or may not exist, but again, a sort of an assumption of willingness to take on that particular role. I mean, do you have any sort of thoughts about who it is we trust in these particular situations, where our knowledge is coming from, and constructions of that knowledge? Whether that in fact is also linked to notions of masculinity and femininity. And I think perhaps, we're coming up to the end of the time, whether both of you have got any reflections on that, and perhaps some final thoughts of anything you would like to leave as a basic message. So Henry, your sort of final thoughts.
Yeah, I think sort of the question of expertise is a really interesting one, and I don't really have a straight answer to that. I think that it's probably too early to tell what kind of responses have worked best in the long run. And in countries like Sweden, for example, there's a lot of questioning of whether or not the path that was taken was the right one. I mean, it's clear that some countries, like let's say the US and the UK have, or Brazil for that matter, have taken a path that has really not worked so far. But even in countries where there was that trust in the medical expertise, in the response of the government, sometimes that hasn't led to the expected results. But I think that there is a lot of sort of punditry also happening in let's say Fox News or other spaces, where you do have self-professed experts coming up with solutions or comments which are really not helpful at all to the situation.
And any final thoughts? No.
Yeah, no, I think it's I'm hoping that this pandemic will lead to an opening up of some of the discussions that I mentioned earlier in a positive way, in terms of what kind of labor is valued and what kind of leadership qualities are valued. But I think it's also, it already has opened up some important discussions around the need to look more at the invisibilized sides of these kinds of crises, for example, around domestic violence. And I think it's really important, the kind of work that organizations like Bahar's organization is doing at the grassroots level to try and highlight some of these issues that we don't necessarily or hadn't necessarily thought about immediately when there was the immediate outbreak of the pandemic, but which impact negatively so many people's lives.
Thank you. And Bahar, any sort of thoughts on expertise and how we learn about expertise? Who do we trust with respect to expertise? And any final thoughts that you may have?
Yes, through these activities, I think it is very important, but we need support from universities, we need support from education department, we need support to publish, to raise awareness about this issue in our society. And in PDO, we have a program to have a leadership for young women from universities. We had a good capacity building for them, but we should use all this capacity we have from organizations, but we need actually in our society, we need support from others. For example, it is very important that universities can have a research about these issues in Kurdistan. And media, they have too much power in our society and social media. And as I said, we need to collect all these things and to work on it. And from media, we can also have awareness before, for example, women issue in Kurdistan in general, it was more important in now, because before you had some programs, you had something awareness raising, but in quarantine time, it was nothing about this, actually about women issue and violence and honor killing and these things. We need to have a more support to work on these issues in our society.
So unfortunately, we are out of time. So what it remains for me to do is to thank both of you very much indeed for giving up your time, to thank all participants very much as well for joining us. And I'm sure that we've had a lot to reflect on, and we'll continue to reflect on as as we see whatever the next stage of the pandemic, how it transpires. So thank you all very much, and I hope everybody has a good rest of the day. So thank you.
Thank you. Thank you.